Bismillahirrahmanirrahim. Today we will start with eyelids and its disorders. Your learning objectives are to know the differential diagnosis of lid swelling, able to identify blepharitis, stye, clesion, trichiasis, entropion, ectropion, ptosis, and common lid tumors. In this diagram, you can see the vertical cut section of upper lid, which starts from the skin, then comes orbicularis oculi, then the tarsal muscle, and innermost is the conjunctival mucosal lining of the lid. Palpebral, preseptal and orbital portion of the orbicularis oculi are visible. That surrounds the upper and lower eyelid. In this diagram, you can see there are multiple scales at the base of eyelashes. Blepharitis is inflammation of lid margin. There are two types of blepharitis, squamous blepharitis and ulcerative blepharitis. Squamous blepharitis is usually seen in elderly. It is associated with skin diseases like seborrhea, and the patient has complaint of dandruff-like material deposits in scalp, on face, and other areas of the body. On lid margin, you can see the multiple scales which are easily removable through the base, and there is no bleeding seen at the margin of lid lash. In ulcerative blepharitis, there are slightly thick scale with the small wounds apparent on the margin of lid. If you remove these thick scales, there you can see a small bleeder at the base. Usually seen in younger age group, it is not associated with other skin diseases. Staphylococcal are normal infections associated with it. In this diagram, you can see an elevated small area with the pus point on its upper margin at the lateral part of lid associated with lid swelling. This type of swelling is usually associated with pain and fever. The cause of this swelling is infection of eyelash root and associated gland of Zeiss and mole with Staph aureus. Another type of lid swelling is clesion, that is without any pus point, away from lid margin, globular in shape. If you invert the lid margin in the patient with the clesion on inner side, you can see the inflamed overlying area. This is the clesion clamp. If the patient is suffering from clesion, then you apply this clesion clamp on the affected or involved area, and with the help of 11 number blade, you give a vertical incision and drain the material inside the meibomian gland duct. This is inflamed clesion that is known as internal hordeolum. It is usually painful, and under the antibiotic cover, the treatment is same, incision curettage. This is the inner surface of internal hordeolum. In this style, you remove the eyelash associated with the pus and you give the antibiotic. If the patient has severe upper lid swelling, you can also add the systemic antibiotics. But for clesion, you need to do surgical procedure, that is incision curettage. If you see such lesions on lids, that is vesiculopustular lesions, these are usually associated with the herpes infections. Crops of small vesicles are seen involving the lid, which later on rupture and crust is formed, and usually they heal without any scarring within days. Here you can see a small swelling, whitish in color, involving the medial margin of both eyelid. It is slightly smaller on the right side and longer and flatter on the left side. It is known as xanthelasma. In 33% of patients with diabetes or hypertension which suffer from dyslipidemia, that is deranged level of cholesterol, hyperlipidemia, they can suffer from such lesions. Here the small lesion is seen on upper lid of the left eye of the patient. It is usually in shape of the nodule. This is also an infection with the molluscum contagiosum. What you need to do with this lesion is that simple excision of the lesion is required, and this is a viral infection due to the pox virus. Follicular conjunctivitis, it is a feature of viral conjunctivitis, and you can see this small follicle involving the lower lid conjunctiva. Treatment is that if the patient is suffering from viral diseases, then acyclovir, that is antiviral drug ointment, can be used, and you need to prevent the patient from going into the keratitis. Herpes zoster infection is another infection with herpes virus group. But in case of herpes simplex, where you see the simple vesicular rash, in herpes zoster you see the involvement of forehead with the vesicular-papular rash and swelling of the upper and lower lids. If the tip of nose is also involved, then it is a dangerous sign. It is known as Chinson sign. It means that the risk of involvement of cornea is more in cases if the tip of the nose is also involved. These are predisposing factors. Treatment of herpes zoster ophthalmicus is systemic antivirals, that is acyclovir or valacyclovir or famciclovir. You can refer the patient to the dermatologist or skin specialist. Patient also need antidepressive drugs to counteract post-herpetic neuralgia. Entropion is another lesion of lid margin. Entropion is inward rotation of lid margin. When the lid will be rotated inward, the eyelashes will cause irritation to the cornea, and it can lead to permanent scarring and keratitis. This is the cicatricial ectropion, that after injury, for example, some chemical injury, cicatrization occur and inward rolling of the lid margin is seen. This is senile entropion. When the preseptal and pretarsal muscles of the orbicularis oculi, they slide over each other and the upper lid is rolled inward. The treatment of entropion at the level of third year, you need to know that treatment of entropion is surgical correction. Don't go into the detail of operations. Another term is ectropion. Ectropion is opposite to the entropion, that is outward rotation of lid margin. If the lower, here you can see the lower lid is outward rotated. You can see the punctum will also be everted outward, so drainage will be hampered and the patient will suffer from constant epiphora, that is dribbling of the tears over the cheeks. This is ectropion of lower lid. This is cicatricial ectropion, where after injury the lower lid of the left eye of the patient is rotated outward. Here, as patient is unable to close the eye properly, the corneal involvement is also seen and patient cornea is not clear, that is whitish in color, scarring of the cornea. This is paralytic ectropion. This is seen after the seventh nerve palsy, when the supply of orbicularis oculi is through the seventh nerve, that is hampered and patient is unable to close the eye properly. So lower lid is involved and this is example of paralytic ectropion. Involutionary ectropion is due to age related changes, the lower lid is slightly lax and rotated outward. Here is the grading of ectropion depending upon severity. Treatment of ectropion is surgical correction of ectropion. Trichiasis or pseudotrichiasis. Trichiasis are misdirected eyelashes. Misdirected eyelashes are commonly seen in trachoma and in upper lid or lower lid entropion, where the lid margin is rotated inward and lashes irritate the cornea and conjunctiva. Port wine stain. Also, although it is less common in our country, but in white races and in East Asia, there are the people with the large meningioma involving the face and lids. It is associated with glaucoma. In this picture you can see blackish swelling involving the lower margin of right eye of the patient. It can be benign or malignant, but the one showing the picture is typical example of basal cell carcinoma, that is malignant tumor of lid. Here you can find an abnormality that upper lid crease is absent in both upper lids, which is usually present, and the upper lid is covering the whole of the globe and cornea and unable to see upward. It is a case of bilateral sphere congenital ptosis. Here the ptosis is unilateral and it is seen in cases of third nerve palsies. Neurogenic ptosis. When due to third nerve palsy, the left eye of the patient is involved and patient is unable to open the eye. Myogenic ptosis. When there is abnormality in levator palpebrae superioris and patient is unable to open the eyes as normal, and you can also see the absent lid crease. Aponeurotic ptosis. There is excessive skin fold present on both of the upper lids. It is more prominent on the right side. Mechanical ptosis. Left eye of the patient is involved due to large lesion or neurofibroma. The upper lid is slightly at the lower level as compared to right. There are different types of ptosis: neurogenic, myogenic, epineurotic, and mechanical. But you need to identify the patient with the ptosis. Here are grading of ptosis with the levator function. The treatment of ptosis is surgical correction of ptosis. So by far we have covered: number 1, what are the different diseases of lids? Number 2, what is clesion and sty? What is the difference between squamous and ulcerative blepharitis and how it looks like? And what are different types of ptosis? What is ectropion and what is entropion? Now you need to go through your chapter with the eyelids. Kindly look at the diagrams which are given there. For any query, we are giving you the WhatsApp number. For any query, you can send your message with your attendance there. Thank you.